Page B5 is the lateral pterygoid. I mentioned in the lecture that this one is really relevant to TMJ pain because of its relationship to the articular disc and to the positioning of the jaw, front back. Its role in pulling the condyle forward when you open your jaw. It's a key structure to work whenever you have jaw pain on a particular side. And it's mentioned it's going to pull this side forward, so that's the one we felt was the right one going forward. We did the condyle check, so we're going to work this one first. So you can open your jaw, and then Eric, shift your jaw to the right, towards me. Other way. There.
Oh,
yeah. And what that does is it opens up the space for me to go straight back along the upper teeth, all the way back. And one thing I'll feel along the way back, especially if you're doing it with yourself right now, is that coracoid process on the mandible, where the temporalis tendon attaches. I go between it and the teeth, keep going back until I come to the medial pterygoid, back behind the top molars. How are we doing, Rick? Sensitive? The outer hand, a little bit. The outer hand is helping me orient. I'm just below the zygomatic arch, feeling the bony structure of the skull, and that just gives me some three-dimensional orientation so that I can go right to the lateral pterygoid. If you want to add any movement, additional movement, you can slide your jaw slightly forward, just a little millimeter or two. That's plenty. It's very sensitive on many people, partly because of the scarring that can happen from the injections there, different things. But super sensitive touch, just patient, waiting. Pressure is gentle, but it's straight back. Once a minute or two has passed, or a breath, 1 to 3 breaths, that's probably plenty of stimulus for that side. So we come on back. You're nodding your head, huh?
That's good.
That's good. It can be an intense spot. If someone has jaw pain, it can be particularly tender, but not necessarily. Sometimes the effect is afterwards in the relief from the tight pterygoid on that side. Any questions?
Yes. What causes scarring with the injections? Is it the inflammatory of the fluid they're injecting?
Could be the puncture itself of the needle. Could be the chemicals that are being injected into the muscular tissue.
Could be any of that.
Any of that. Could be just the thought of having a needle stuck in you that gives you a little bit of clench response.
So could it be from the amount of fluid being pushed in there?
Could be.
Or do they
Sure.
do that slowly?
It could be.
So, and I have a question.
Sure.
And I noticed more that you were like creating space.
Creating space.
But like if there's a tender spot, like should you like hang out there or no? Because I noticed that was not your intention.
That's a great question. We're not really looking for tender spots and releasing them like you might a trigger point or something.
Exactly.
That's valuable work. It's a great thing to do. And sometimes I do that.
Because I felt that, okay, there was that spot, and anything, oh, I wish it would hang out there.
Yeah.
Then you were just like, creating the space. So I wonder, like, what is the intention?
We could. And sometimes I'll have the clients communicate to me because there is a lot of value in kind of reducing the sensitivity of those places by hanging out on them. But that's like trigger point work. It's a different modality. We're thinking space, like you said, movement options, proprioception, those different things.
Okay.
And so we're feeling for the lack of those things and helping them come in.
And learning the internal relationships within the body for the particular issue is really key. And that's what we get in these workshops. And it's just fabulous.